You're watching America's healthiest TV show, Health Corner, with host Joan Lunden, plus Chef M.D. Dr. John LaPuma, and fitness with Kathy Smith. Today on Health Corner,
new weight loss procedures that UDoc Mike Roizen says may save thousands of lives. Les Duncan shares his amazing story of hope and recovery. Style expert Clinton Kelly with some sensible fashion advice. Plus,
it takes 2 years and 2 gallons of milk to make a pound of this cheese. And you're going to want some today on Chef M.D.
Health Corner is a sponsored program brought to you by Walgreens, the pharmacy America trusts since 1901.
hi, I'm Joan Lunden, and I'm happy to be hosting the new season of Health Corner. On today's show, UDoc Dr. Mike Roizen says belly fat needlessly kills thousands of Americans every year. But there is hope, thanks to new weight loss procedures. And one procedure dramatically changed the life of actress Caitlin Van Zant. Here's her story.
As Ashley Wolf on Guiding Light, Caitlin Van Zant is a successful actress. But behind the scenes, the 22-year-old has been coping with a personal storyline that has plagued her all her life.
Unfortunately, I always struggled with my weight from a young age. I really loved performing, and I never let it stop me. But I realized by the time I hit high school that I was obese, and which is a very scary word.
Caitlin exercised and dieted, but no matter how hard she tried, she just couldn't keep off the weight.
I hated to watch myself because I couldn't even focus on my performance or the storyline or anything entertaining. It was all about how big I looked. I had given up hope that I could ever lose weight, so I was kind of resigned to this life of being unhappy with how I looked and unhealthy.
That is until she teamed up with Dr. Mike Roizen of the Cleveland Clinic, You on a Diet fame, and RealAge.com. He's constantly motivating patients about the dangers of belly fat, which he believes is literally killing America.
This is 5 pounds of belly fat. And the average American, imagine carrying 20 of these. That's what 100 pounds is.
All that excess weight people carry around their middle has its consequences. Diabetes, heart disease, sleep apnea, just to name a few. So what's a person to do when diet and exercise don't work? Dr. Roizen says the first step, stop being embarrassed about it.
If they can't make it with diet and exercise, and many people can't, then they need to talk about other alternatives, such as gastric banding with their physician.
My moment of truth was when I knew that that there was an option for me, that I could lose the weight and keep it off.
With her mother also battling a weight problem, Caitlin underwent gastric banding using the lap band AP system, a minimally invasive procedure that helps control hunger.
The lap band AP system is an adjustable, removable band that's put around the top portion of your stomach to create like a little second stomach, so that you get fuller faster. You chew your food well, you take time with your meals, you enjoy your company.
It's on a case-by-case basis, but the key is breaking down that barrier to being embarrassed.
Following surgery, Caitlin dropped 65 pounds.
I feel wonderful. I feel very sexy and very present in my body.
Wanting to share her success, the actress made her weight loss surgery part of the soap opera storyline.
My character, Ashley, went through the same exact gastric banding procedure. And I liked that I was able to show that because there is a stigma and it need not be there.
For this actress, her latest role, helping others struggling with obesity understand that weight loss surgery may be an option for living a happy, healthier life.
You do deserve it. I deserve it. And you deserve to treat yourself as well as you treat others. And being healthy is a huge part of that.
if your waist size isn't where it should be, don't let it become a health risk. Dr. Roizen says a brisk 30-minute walk every day keeps fat cells from expanding. We can all do that. Great advice, doctor. Now, it seems everyone's going green, and for good reason. Here's our kids reporters with some advice about shrinking your plastic footprint. Hi, girls.
Thanks, Joan. Okay, Gabby, which one do you like better? Stainless steel or plastic?
I don't know why.
Because these babies are going to help us save money, protect the environment, and be healthier.
Okay, if you say so.
Seriously, instead of buying bottled water, we fill these up with tap water. And we don't have to worry about scary chemicals from plastic getting into our system. Plus, we keep water bottles out of landfills.
So we save money, help the planet, and ourselves. I like the green one.
For Kids Go Green, I'm Michaela Powell.
And I'm Gabby Powell. See you next time.
Sudsy smiles, blowing bubbles, lots of giggles. Bath time is a special time for baby and for you. So here's what you need to know to make it safe and so much fun. First, be aware of water temperature. Water between 90 and 100 degrees is perfect. Not sure how to check? Use your kitchen thermometer. Next, never leave your child alone. Make sure your baby is supported and doesn't slip. Use a non-slip mat for extra protection. Children get bumps and bruises all the time, and the bathtub is no exception. Use a padded faucet cover to prevent a head-on collision. And choose products that are gentle and specially made for baby's young, sensitive skin. When you take the necessary precautions, baby's bath time will be fun and special bonding time for you and your baby. For Kids Corner, I'm Jill Repp.
Coming up, we'll meet Les Duncan. He's a regular Health Corner viewer, and his story is so amazing we just had to share it with you. So stay with us.
Hey, there's no room in here.
Why don't you develop a photo once in a while?
Gotta be kidding me.
Uh-oh, somebody's gonna get deleted.
Oh, no.
Not me. I got deleted last time.
If only your memory card always had space for those great new photos. Fortunately, you can put your photos on Walgreens.com and have prints ready for friends and family to pick up at multiple Walgreens nationwide, usually within an hour.
For fast heartburn relief, Sarah and Amy do things very differently. Amy chews just one Pepcid Complete. Sarah chews a few Tums. And when heartburn returns, a few more. But Amy's one Pepcid Complete starts to neutralize acid in seconds and keeps working all night. So while Sarah may have to take Tums again, Amy puts her heartburn to rest with Pepcid Complete. Chew one and heartburn's done.
What does hope look like? Sometimes it's a hug or a laugh, and sometimes it's a future without worry. But most of all, hope looks like these children and me, who live with type 1 diabetes. The Juvenile Diabetes Research Foundation continues to accelerate the crucial research that represents the real hope for a cure for millions of children and adults. Their hope is boundless, and with your help, we'll find a cure.
Miserable elbows? The skin therapist says miserable elbows can find happiness with 24 hours of continuous healing moisture. You'll get it with Lubriderm Intense Skin Repair. Its 24-hour formula is clinically shown to help every inch of extremely rough, dry skin heal itself like healthy skin does naturally. Now arms can look forward to wearing sleeveless tops again. Dermatologist-developed Lubriderm, the skin therapist.
Welcome back to Health Corner. Now here's Chef M.D. Dr. John LaPuma with some great news about the health benefits of one of my favorite foods, cheese.
Take this Parmigiano Reggiano. It comes from the milk of very special cows. It's a 70-pound wheel, and it's rich and sweet and nutty. Hard white cheeses like Parmigiano Reggiano deliver a calcium and protein punch and are lower in fat than most cheeses. Plus, Parmigiano is very low in lactose, which is important if you're lactose intolerant. Always grate your own when you can. That keeps the flavor bright and tangy and brilliant. I think that's enough. So, say cheese and join me later in the show for my Chef M.D. approved and budget-friendly pasta shells with melty butternut squash and Parmigiano Reggiano.
Can't wait to see how that turns out. Thanks, John. Now, do you get Chef MD's weekly recipe emails? It's free, it's easy. Just visit healthcornertv.com to sign up. All right, caregiving can be an all-consuming job for millions of people caring for the elderly, and Suzanne Kleppner is no exception. Here's her story.
My name is Suzanne Kleppner, and I've been a caregiver for my mom for the last 3 years since she had her stroke. She can't walk. She can't use her right arm or her right ankle and foot. She has a hard time swallowing sometimes. I love being with my mom and caring for her and everything, but there's times when we need some time off.
Respite care is vital to that caregiving role because it helps the caregiver to get some time away to take care of themselves.
I'd be happy with 1 weekend a month. 1 weekend a month I could handle. It's just needing to just have a little bit of time to meet.
One of the most difficult issues that caregivers have with respite care is asking for it.
It's just not real easy to do. You know, we have done it, but it's not easy.
Many times care receivers are reluctant to have new people come in. We all are reticent sometimes to accept strangers into our lives. What caregivers can do is to stay at home the first time that the respite person comes to their home. Respite care can bring you a renewed spirit.
It's not a burden. I love taking care of my mom, but everybody needs a break.
Our thanks to Suzanne and her family for sharing their story. Asking for help isn't always easy for caregivers, but remember, your own health and well-being is also important. And now, when you love what you do, work doesn't seem like work. So, how do you find your true passion? Here's Megan Sinclair with some good advice.
Did you know the average American works 42 hours a week? And if you don't like your job, it can seem even longer. Well, remember that saying, do what you love and love what you do? Turns out it's easier than you think. Start by figuring out which tasks make you happiest. Once you know your strengths, you can try to find a job to match. Devote time to asking yourself some tough questions about work and career. Do you get to do what you like to do? Do you feel like you're making a difference? Do you make the money you think you deserve? Then just keep honing the skills you really enjoy, whether it's interacting with customers or developing marketing plans. That way, you'll be fueling your passion on a daily basis. And when the opportunity arises, you'll be ready to pounce. Doing something you love makes all the difference in your quality of life, especially when you consider all the time you invest in your job, which, if you play your cards right, will start feeling a lot less like a job. For Health Corner, I'm Megan Sinclair.
Most of us are pretty familiar with heartburn, but what you may not know is how many different causes there are. Here's Walgreens pharmacist John Jenkins with more. Hi, John.
Hi, Joan. Yes, it's a lot more than spicy foods. Chocolate, onions, tomato sauce, and even carbonated drinks can trigger heartburn.
And then there are other causes, too, like being overweight or pregnancy, even stress, right?
Right, and since heartburn is essentially stomach acid backing up into your esophagus, lying down too soon after eating can cause it too. Even wearing clothes that are too tight might cause it.
That actually makes sense, and a lot of people might not think of that. Now, what do you recommend for those who have heartburn?
There are several effective over-the-counter medications that relieve heartburn, and different kinds are formulated for how frequent or severe it is. But if heartburn persists after changing your diet or taking medicine, see your doctor.
Great advice. Thanks, John.
My pleasure, Joan.
This portion of Health Corner is brought to you by Zyrtec Allergy Medicine. Now available without a prescription at full prescription strength.
Take it down and press it up. Good one. Too many people aren't getting the most out of their push-ups because they're not performing them through a full range of motion. So here's a simple exercise that helps you train your body through a full range of motion. Get yourself into a plank position, making sure the shoulders are directly over the wrists. Now lower yourself down for 6 counts. 1, 2, 3, 4, 5, 6. Touch down, bend the knees, push back up again. So that simple exercise of training yourself to go through a full range of motion allows you to go back to your real push-up, and whether you do it on your toes or on your knees, now you're really using every part of that movement instead of shortchanging yourself with a small little thing like this. So, in the future, when you want to make sure that you're working your shoulders and your chest, you use a wider stance. If you want to work just the triceps, pull those arms in a little bit, and that's going to give you that nice definition in the back of your arm. Try working up to 2 sets of 10 push-ups. With this new technique, you're really going to get a lot out of one simple exercise. I'm Kathy Smith, and here's to your health.
Looking for the secret to losing weight and keeping it off? Find out how at kathysmith.com.
Legend has it that people loved this cheese so much, they buried some during the Great London Fire of 1666 to preserve it. That's well aged. We'll use it today on Chef M.D.
Have you heard the news about Zyrtec? It's fast relief for people with indoor allergies, with outdoor allergies, or people like me who have both.
Zyrtec is fast. In fact, it starts working 2 hours faster than Claritin. It's clinically proven to relieve even your worst allergy symptoms.
From dust mites and pet dander to ragweed and pollen for a full 24 hours. Now I'm freer to do what I want, where I want, even faster.
Zyrtec, the fastest 24-hour allergy relief.
Do you know what today is?
Of course I do.
Did you get me a present?
No, I didn't.
Flowers?
No.
A card?
No. But I meant to.
You meant to.
I did. I really thought about it.
If only it really was the thought that counts.
I love you.
Fortunately, Walgreens has thousands of locations, many open 24 hours, with the Hallmark cards and gift wrap you need for any occasion.
Did you rinse this morning? If you did, your mouth will thank you. Listerine doesn't just wake up your senses. It's also proven to reduce gingivitis up to 36% and plaque up to 56%. Germs never take a day off, and neither should you. Start your day with a healthier mouth. Say goodbye to germs. And say good morning to Listerine. And for kids, Listerine Agent Cool Blue Tinting Rinse. The fun way to learn better brushing.
Welcome back. Our beauty expert, Florida Perry Smith, has a special guest, someone who knows a thing or two about what not to wear.
When it comes to looking and feeling fabulous, how you dress has an enormous impact. Here with some secrets for style success is What Not to Wear host and author of the new book, Freakin' Fabulous, Clinton Kelly.
There are three main components to style: fit, proportion, and appropriateness. And if you can master those three ideas, then you can have great style. You have to learn how clothes fit on your body. If you're wearing a $4,000 Prada suit, let's say, that's too tight, you're gonna look like a stuffed sausage. If it's too big, you look schlumpy and dumpy. So you have to make sure that your clothes are fitting your frame correctly. The other aspect is proportion. Now you have to sort of get what proportion means. Proportion means that if you have a larger frame, you should be doing prints and accessories that are larger in keeping with your frame. If you've got a smaller frame, you want to do accessories and prints that are slightly smaller so that they don't overwhelm you. And then the last is appropriateness. You could be looking amazing in a white dress that fits you perfectly and all of your accessories are to scale. However, if you wear that white dress to a wedding, you don't have style because that is inappropriate to wear that white dress to a wedding.
Thanks so much, Clinton. To always look your best and have that certain something, just remember Clinton Style Advice. For Health Corner, I'm Florida Perry Smith.
This portion of Health Corner is brought to you by Sudafed PE Day and Night Dual Pack. Use only as directed. Which products are right for you? Ask your Walgreens Beauty Advisor for help. They have the knowledge and expertise you need to look and feel your best.
When Sharon Duncan emailed Health Corner, we just knew that we had to tell her husband's story. Les has cavernous angioma. It's a brain condition that causes the brain to bleed, and Les has fought back, and today he shares his amazing story.
I think I might play some golf today.
Les Duncan does just about everything with purpose these days, because even the small tasks were hard-won.
I've had 4 brain hemorrhages, 4 brain bleeds, and 2 brain surgeries, and each time I had a hemorrhage and then the consequence of trauma of a surgery as well, I was severely handicapped.
Duncan has literally crawled his way back from catastrophic illness over and over again.
I have a genetic condition called cavernous angioma, and it's a condition that causes the blood vessels in my brain and spine to become tangled and knotted, and sometimes these bleed. They cause stroke or seizure or both.
Generally, we think of blood vessels as tube-shaped, but in a cavernous malformation, the blood vessel doesn't form right and forms caverns instead of a tube shape.
Dr. Kelly Fleming says that most people with this condition never know they have it.
Some people have no symptoms and will never have symptoms.
Genetic bad luck means Les Duncan has the kind of cavernous formations that bleed.
Right here is a very classic cavernous malformation.
And cause major neurological damage.
I had to learn how to eat again. I had to learn how to drink again. I had to learn how to walk again.
Each time, Les Duncan recovered with a lot of sweat, pain, and a singular purpose.
I never allowed myself to believe that I wouldn't get better.
It took him more than a year to get back to this point after his 4th brain bleed. He's learned how to survive catastrophic illness with the help of his wife and cheerleader, Sharon. Now he's sharing the lessons he learned during recovery in his book, Brainstorms.
Listen to your body. It's very important. Your body is going to tell you when you're really sick. You have to have patience. It takes time for your body to heal.
Duncan also learned you have to make recovery a full-time job, find the very best doctors, and celebrate every baby step of progress.
The more we learn about how these form, the more possibilities of developing medications might exist. But right now, we just don't have any medications that would prevent bleeding.
No cure means Les could find himself fighting the brainstorm again.
I don't get anxious about this. It's counterproductive. And I'm doing everything possible to keep it from happening again. And so I just continue to live my life.
A life full of family, activity, and the knowledge that whatever happens, he can get back to what he calls the new normal.
The new normal means that I'm not the way I used to be, but I am what I am. And, I've recovered about, I would say, at least 95, maybe even 98%. All the important things are back.
For Health Corner, I'm Elisa Adams.
You can get it in powdered form, but you won't believe the difference when we grate it fresh and top my pasta with butternut squash. Coming up.
My sinuses are so congested, I can't think.
The pressure's keeping me up at night.
My sinuses are about to explode.
Introducing Sudafed PE Day and Night Dual Pack. Maximum strength relief of sinus pressure and congestion. 2 different tablets relieve sinus symptoms so you can get through the day and rest at night.
My sinuses are relieved.
I feel rested.
I feel like myself again.
Sudafed PE Day and Night. Unblock your head.
What if we took the great taste of Splenda no-calorie sweetener and added a little fiber?
Sweet.
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 Introducing Splenda no-calorie sweetener with fiber. Now for the first time, a gram of healthy fiber in every packet.
Sweet.
Splenda no-calorie sweetener is made from sugar, tastes like sugar, but it's not sugar. No calories and a little fiber. How does that taste?
Sweet. Sweet.
New Splenda with fiber. Just what's good.
300 cities, 10 big buses, $35 million of free health screenings.
It's a phenomenal opportunity to give back to the community.
It's the Walgreens Take Care Health Tour. We're screening blood pressure, total cholesterol levels, and more, while bringing health care to as many places as we can.
When they leave this bus, we've helped them. And I think it's incredible that Walgreens is doing that.
Even places where it's hard to find a parking spot. To see when the tour will be visiting your town, go to walgreens.com/takecare.
Butternut squash has become a staple of a healthy and tasty winter diet. Soups, stews, side dishes, it's a universally loved vegetable that keeps for 2 months or more. And today, it's part of this wonderful, melty butternut squash and whole wheat pasta dish. You need to peel the butternut squash, and then you just make cubes out of it. They don't have to be perfectly the same size, but it helps that they're approximately the same size. We're going to saute some onion and butternut squash for this melty, beautiful, healthy, easy-to-make dish. And we start by heating a little oil in a large saucepan. It's extra light olive oil, which has a very high smoke temperature and is great for sauteing. Add the onion, then the butternut squash. The oil helps you absorb the beta-carotene in the butternut squash, and that's one of the reasons to saute it. Now, you can add the garlic with this too. I'm just going to let that saute for a few minutes. Butternut squash has actually been called a superfood in some medical journals because of the nutrients it packs. Not only beta-carotene, but potassium, vitamin C, iron, and this recipe is so easy to make, it actually gets better in flavor the next day. The antioxidants in butternut squash actually help your arteries from rusting, keeps them from rusting. And the dish itself actually has a low glycemic load. It raises your blood sugar gently and not quickly, which is especially important if you have diabetes. Now, what we'll do next is add some good vegetable broth and some good white wine. It's important that this broth get hot. We'll add the whole wheat pasta too, but I won't do that now because it takes 12 minutes to get all the way done. I already have one done. Good garlic, good onion, beautiful butternut squash, nice and soft. Now, a little bit about our food as medicine ingredient, Parmigiano Reggiano. Parmigiano Reggiano is a high-protein cheese. In fact, it's 36% protein. You know, one of the nice things about Parmigiano Reggiano is that a little looks like a lot. That's actually barely an ounce of cheese. A little bit of sage. Why sage? Because it's classic with Parmigiano Reggiano, and it smells like fall and winter put together. It's really fabulous. I'm just going to slice a little bit so that I'll be able to sprinkle it on top. You'll get that little bit of pungency as you eat, and it provides terrific color contrast as well. There you have it. Melty butternut squash with whole wheat pasta shells and Parmigiano Reggiano. For the complete recipe, check out our website. And remember, the fountain of youth starts in the kitchen. Chadani, may you live 100 years. For Chef M.D., I'm Dr. John LaPuma.
Learn more about culinary medicine today. Order Chef M.D.'s Big Book of Culinary Medicine at chefmd.com and sign up for free weekly recipe emails while you're there.
That's our show for today. Thanks for watching America's healthiest TV show, and a special thanks to our guests for sharing their amazing stories. Visit healthcornertv.com for more of our interview with Dr. Roizen and with Caitlin Van Zandt. Until we see you next week, take care.
Next week on Health Corner.
Plus-size supermodel Emmy and how she's doing after overcoming cancer.
Something really was inside of me that said, get the support that you need. Let everyone know what's going on.
Healthy aging advice from some people you may recognize.
Just because you're stuck where you are right now doesn't mean you have to be stuck that way tomorrow or the next day or the next day. Just get up and do it. Changes will happen.
Kathy Smith helps you design your very own home gym. Plus,
who says it's not easy being green? My simple dieter's delight. Vegetarian navy bean and collard green soup on Chef M.D.
Health Corner is a sponsored program brought to you by Walgreens.